Hi, my name is Melissa,
Hi, my name's Anaí.
and today we'll be discussing diabetes case scenario. So for our patient demographic, our patient is a 33-year-old Caucasian female patient. She's a stay-at-home mom, presents with a chief complaint of inflamed gums that bleed easily when brushing and flossing. For the patient's medical condition, signs, and symptoms, the patient is classified as ASA2 due to type 1 diabetes, diagnosed at age 28, with cardinal symptoms including frequent urination, excessive thirstiness, unexplained weight loss, and fatigue. Additionally, the patient reports numbness and tingling in her hands and feet. The current patient treatment and medication. Since she does have type 1 diabetes, the patient is currently managed by metformin and insulin pro. The effects on oral health. For the salivary and oral changes, the patient experienced xerostomia and increased dental caries. For periodontal, the patient does have mobility and rapidly progressive pocket formation and gingival bleeding, infection and wound healing. There is slow wound healing, increased infection and oral ulcers, irritation, and prolonged healing of dry socket. For the tongue changes, there is glossitis. For management and special precautions for type 1, so before treatment, it's good to schedule brief morning appointments, review the patient's HbA1c levels with less than 7, indicating good control over the past 3 months, and greater than 8, suggesting poor control. And it's also important to require patient medication updates and their daily regimen, whether it's self-administered or through insulin infusion, and monitor oral disease progression, oral hygiene, and diet, and ensure a source of glucose is ready.
Social, physiological, and cultural factors barriers. For social, is insufficient economic assistance and inadequate family support. Psychological is stressful, anxious, and fearful. Cultural, poor understanding of the disease condition and a lack of that inner drive to make an effort for change. Not aware of the impact it can have on her oral health. Case scenario. The patient was scheduled at 2 p.m. for scaling and root planing of the upper and lower right quadrants with LA code 3 medium, presented with vitals within normal limits, but with stage 1 hypertension. Blood pressure was 126/82, her pulse 86, respiration 14, temperature 97, oxygen 99, and exhibited generalized periodontal pockets 2 to 3 millimeters with localized areas measuring 5 to 6 millimeters. After reviewing the patient's medical history, the patient reported feeling unwell. The patient stated she felt shaky, anxious, and dizzy. It turned out the patient had a heavy breakfast, so she decided to skip lunch before her arrival and was asked to check her glucose level, which measured 59 milligrams. Questions. Is the patient glucose reading within a safe range to continue dental treatment? What are the implications for dental hygiene care in this situation? Management. Stop treatment, sit patient upright, treat with 15 milligrams of simple carbohydrates, drink half a soda or 4 ounces of juice or 3 to 4 glucose tablets. Some of the emergency kit items that we can use is epinephrine auto-injector, nitroglycerin spray, ammonia inhalant, or oral glucose gel. Wait about 15 minutes for the patient to recover. Reschedule the patient for a morning appointment and remind them to eat before. And these are our resources.